Thank you all for joining us for our data release webinar on accessing and using data from the Early Head Start Childcare, or EHS-CC Partnership Sustainability Study. My name is Vrinda Mahishi, and I am a data project manager for the Child and Family Data Archive, also known as CF Data. I'm joined today by our colleagues from Mathematica, Sheila Albanese and Liza Doran. Will lead the presentation today, but before I turn it over to them, I will briefly introduce you to the Child and Family Data Archive and let you know about the structure of this webinar. This webinar is hosted by CF Data, which is where you go to access the EHS-CC partnership data. CF Data is supported by a contract from the Office of Planning, Research, and Evaluation, or OPRE, and housed at ICPSR within the University of Michigan. It is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. You can access our over 350 data sets with the ability to analyze select data sets online. Users can also search and compare variables and peruse our data-related publications. And of course, user support is also available to assist you in finding and obtaining data. I will go into a bit more detail about the archive later on in the webinar. For today's webinar, Liza and Sheila will provide you with an overview of the EHS-CC Partnership Sustainability Study, as well as information on the study design and sample. Then they'll describe both the quantitative and qualitative data sets and discuss the data file structure and conventions, including the use of sampling weights in survey data analysis. They'll then discuss limitations of the data and finally how to merge the data files together. Following these sections, I will give an overview of CF Data and the resources that we have to support researchers. Importantly, I will share how users can request access to the sustainability study data through the CF Data website. Finally, we'll close this webinar with a brief question and answer session. I am now happy to pass the presentation over to the Mathematica team so they can share more information on the data.
Great, thank you. We will start with a study overview. Partnerships between early Head Start programs and childcare providers aim to serve more infants and toddlers and promote high quality. Prior to 2015, these were long-standing partnerships between community childcare providers and early Head Start programs. In 2015, 250 Early Head Start Childcare, or EHS-CC partnership grants were awarded to support partnerships. Throughout the presentation, sometimes we'll see the word partnership uses a capital P, and sometimes it uses a lowercase p. When we use capital P, that means we're speaking specifically about these partnerships through the EHS-CC partnership grants. When we use the lowercase p, that means other partnerships between early Head Start programs and providers that are not through an Early Head Start Childcare Partnership grant. EHS-CC partnerships are between early Head Start programs and childcare providers, including childcare centers and family childcare providers. The goals of the partnerships are to build more seamless care systems in communities, to reach more infants and toddlers, and to promote high-quality early care and education services. Early Head Start programs and providers work together to meet these goals by combining funding, resources, materials, and staff, providing comprehensive services, and enhancing service quality. The EHS-CCP dataset contains data from two studies. First, the 2016 National Descriptive Study, the NDS, collected information about the 2015 Early Head Start Childcare Partnership grantees and their childcare partners, including childcare centers and family childcare providers, and the activities they engaged in to develop and maintain partnerships and meet the Head Start program performance standards, assess their quality improvement needs, and support high-quality caregiving and learning environments for infants and toddlers. Second, this study, the Early Head Start Childcare Partnership Sustainability Study of 2022, is a follow-up study of the 2016 NDS. It collected information about how partnerships from the first round of grants had fared as of 2022, and factors that supported or impeded partnership sustainability. The sustainability study focused almost entirely on partnerships from the EHS-CC Partnership Grants of 2015, while the NDS did ask some questions, both about the partnerships from the grants as well as other types of partnerships. Another note about terminology that will come up throughout the presentation. You'll hear us refer to sustained partnerships and dissolved partnerships. Sustained partnerships are those that were in place in 2016 at the time of the NDS and were still in place at the time of the 2022 sustainability study. Dissolved partnerships are those that were in place in 2016 at the time of the NDS, but were no longer in place at the time of the 2022 sustainability study. Here are the study's research questions. I won't read through them, but we wanted to include the full set here. Analysts could use both the survey data and the interview data to look at any of the research questions. There are many research questions that an analyst could answer using the sustainability study data. As we discuss the specifics of the data, today we'll work through how these data could be used to answer one example research question. For the rest of our presentation, we'll focus on the following research question. What factors supported or impeded the partnership's sustainability? Please note that while we're focusing on one of the study research questions for this presentation, analysts are not limited to asking only the study research questions. Many other research questions may be appropriate for analyses. Next, let's talk about the study design and sample. The study design of the sustainability study built off the NDS study design, so it's important to understand the NDS study design first. The NDS study collected data from two sets of web-based surveys, one of EHS-CC partnership programs and one of a random sample of childcare providers that partnered with those EHS programs. In 2015, the Administration for Children and Families awarded 250 EHS programs funding for EHS childcare partnerships. We sent surveys to all of these 250 programs along with their delegate agencies. As part of the program director survey, respondents provided a list of childcare partners and told us what type they were, either childcare centers or licensed family childcare providers. We then randomly selected 1/5 of each type of childcare partner per program that responded to the survey, with a minimum of one of each type of childcare partner per grantee. The childcare partners are therefore a subset of the grant recipients and delegate agencies, in that we only have a list of partners associated with the grant recipients or delegates that responded to the survey. As a note, the NDS materials, including surveys and reports, use different language to identify respondents within the NDS. There, we use program directors and use the word grantees, and childcare providers were referred to as partners. We have moved away from this language in the sustainability study and have updated the NDS language in this presentation to align with the sustainability study language for respondents. The sustainability study design is next. Data comes from 2 surveys and interviews. The Early Head Start programs and childcare providers sampled for the sustainability study of 2022 are the same as those sampled in the NDS of 2016. We asked directors of all 250 Early Head Start programs that received a 2015 grant to complete a survey, regardless of whether they participated in the NDS of 2016. In 15 cases where programs no longer provided EHS services or no longer had a partnership grant, we sent surveys to the best contact information available, according to the Office of Head Start. We asked all 469 providers sampled in the NDS to complete a survey. While the NDS provider sample size was 470, we determined that one case was ineligible. We did not survey childcare providers that established partnerships with EHS programs after the NDS of 2016. The Early Head Start Program Director and Childcare Provider surveys included items from the NDS of 2016, as well as newly developed items. Because of the longitudinal nature of the research questions and design, the survey instruments used the same items fielded in the NDS of 2016 to the extent possible, with some items reworded or reframed if necessary. For semi-structured interviews, the study team drew a purposive sample of providers who were invited to complete the provider surveys, varying the sample on key characteristics, such as provider type, region, proportion of infant-toddler slots funded through the partnership, number of partnerships Early Head Start programs had with childcare providers, and for providers in dissolved partnerships, length of time since partnership dissolved. Our initial sampling plan for the interviews was to interview childcare providers who completed the provider survey, but we broadened that to providers that were invited to participate in the survey when we were having trouble recruiting. All data were collected in 2022. Program director surveys were fielded from February to July, and provider surveys were fielded from March to July. Provider interviews were conducted from June to September. Program directors completed a web-based survey, while providers had the option of completing the survey on the web or over the phone. All provider interviews were conducted over the phone using a semi-structured interview protocol. While planning for the sustainability study began prior to the COVID-19 pandemic, the pandemic added a further challenge to childcare business sustainability and to data collection. As we'll discuss in the next section, we incorporated specific questions about the pandemic into the surveys and the interviews. However, analysts should keep in mind the timing of data collection, even when reviewing items not specifically mentioning the pandemic. For example, providers whose partnerships dissolved before the pandemic and those whose partnerships dissolved after the start of the pandemic might have both faced staffing challenges, but for different reasons. Let's look at the survey and interview data. We'll start with a brief overview of some of the topics that are covered in each instrument. You can refer to the exact survey questions included in the data documentation. Appendices B through E of the data documentation show the full instruments. The Early Head Start Program Director Survey first asked directors about the status of each partnership from the NDS. As part of their survey, program directors reviewed a roster of the partners they reported having in 2016 and indicated whether their programs still partnered with each provider. We used this information to categorize providers as sustained or dissolved. The categorization determined the version of the survey that the providers received. The sustained partnership survey, shown in the table as an S, or the dissolved partnership survey, shown as a D. The provider survey then used this information in a screener to confirm that we correctly categorized the partnership as sustained or dissolved. As you can see, the provider survey included some items that were just for providers in sustained partnerships and some that were just for providers whose partnerships had dissolved. For providers in sustained partnerships, questions focused on factors that helped sustain partnerships. For those in dissolved partnerships, questions focused on reasons partnerships dissolved and the characteristics of the providers after the partnerships dissolved. Program directors and providers in sustained partnerships answered questions related to how the features of the partnerships changed over time, as well as how their own characteristics changed over time. All respondents also answered questions about structures or characteristics of partnerships overall that either supported or acted acted as barriers to sustainability. The interviews included an entire section with questions related to the impact of COVID-19. The surveys had response options related to COVID-19 sprinkled in throughout the questions, as noted by the wavy line. As you saw in the previous slide, the provider survey and the interview protocols cover mostly the same topics. However, the type of information collected from each instrument is different. We designed the interview protocol to provide us with more in-depth understanding of the survey data. To look at how the interview protocols complement the survey items, you can see the interview protocols in the user's guide appendices. D has the sustained partnership protocol, and Appendix E has the dissolved partnership protocol. Here on the left is an example question for the provider survey. This is part of question F1. This question asks the person completing the survey to indicate whether any of the listed factors supported their partnership sustainability. And they noted on a 3-point scale if it was not a support, somewhat of a support, or a major support. On the right, you see the companion question from the interview protocol. It asks interviewees to provide more information on the factors they marked as major supports in the survey. This is a question that we asked providers in sustained partnerships only. Thinking back to our example research question, we can look at several items from the surveys. To look for relevant survey items, you can see the surveys in the user's guide. Appendix B shows the program director survey, and Appendix C shows the provider survey. Two relevant questions are shown here, which asked respondents the degree to which different factors either supported or served as barriers to the sustainability of their partnerships. Program directors rated their agreement with each of these factors on a 3-point scale, with 1 being a low endorsement, 2 being a middle endorsement, and 3 being a high endorsement. The factors shown in the questions for providers were the same as those shown for Early Head Start program directors. The one exception is that Early Head Start program directors were asked about one additional factor that could have been a support and one additional factor that could have been a barrier that was specifically related to program administration, and that we wouldn't have expected providers to have had enough information to report on. Please note that while we focus this particular example within the sustainability study data set, data users could also examine factors from 2016 that predicted sustainability status in 2020 by merging the sustainability study data with NDS data. Later, we'll talk about how to do that. To look at the same research questions within the interview data, you can review the interview protocols in the appendices D and E, respectively. 2 relevant questions are shown here. They're the ones that ask about the survey questions related to supports and barriers that we just looked at on a previous slide. The interview questions build on the responses to the survey questions, asking providers to describe their selections in more detail. For supports, we also asked providers to tell us how the supports helped, how the supports came to be. For the barriers, we asked when the issues started. Did they change over time? Did they talk to the Early Head Start program about it and come up with strategies? And lastly, how the issues might have affected the partnership over time. To look at the themes that appeared from these questions and responses, you can use the code book that is also archived with the interviews. For the sustainability study, the response rate was 64% for the Early Head Start program director survey. Among the 161 Early Head Start program directors who responded to the survey, 160 had also responded to the NDS survey. For the sustainability study, the response rate was 35% for the provider survey. Among the 166 providers who responded to the survey, 156 had also responded to the NDS survey. A little bit later in the presentation, we will talk about non-response and non-response bias, as well as its implications for analyses with this data. For the sustainability study interviews, we had a response rate of 31%. We reached out to 150 respondents and were able to conduct interviews with 47 of them. As anticipated, survey response rates were higher among providers with sustained partnerships than for providers with dissolved partnerships, ranging from 25% to 53%. 124 of the respondents were in sustained partnerships, while 42 respondents were in dissolved partnerships. More respondents were center directors than were family childcare owners or managers, particularly among providers in sustained partnerships. When looking at the interviews by type of provider, 29 center directors and 18 family childcare owners or managers participated. We conducted 28 interviews with providers in sustained partnerships and 19 interviews with providers in dissolved partnerships.
Great, thanks, Sheila. I will now start our discussion on representativeness and the use of survey weights. The purpose of analysis weights is to make the responding sample, or the group of people who did respond to the survey, more representative of the full population. So in this case, the full populations are the programs who received 2015 EHS-CC Partnership grants and the childcare providers who partnered with them. When sampling is involved, as was the case for the childcare providers, the weights account for the probability of selection. The program director sample was a census of all directors in the population, so we did not sample programs. For providers, however, we did not try to survey every provider who partnered with an EHS program in the 2015 round of grants. Instead, we randomly selected providers to try to survey. As with any survey, some portion of the sample will not respond, and this is called survey non-response. Weights also account for different survey non-response patterns among sample members by weighting up or giving more weight to respondents with certain characteristics. Survey non-response bias can occur when people who did not participate in data collection, or non-respondents, would have responded differently enough from those who did participate, or respondents, change the overall results. That is, to bias them by not participating in the data collection. This is of particular concern when response rates are low. A lower response rate does not necessarily indicate the presence of survey non-response bias, but a higher response rate does lower the risk of it. While non-response bias can occur in all forms of data collection, including in qualitative interviews, we don't use weights to try to generalize the interview data to all providers. Rather, the interview data in the sustainability study is intended to provide additional context to survey responses. So we therefore focus this discussion on non-response in survey data. Given our response rates of 64% for the EHS program director surveys and 35% for the provider surveys, we assess the potential for non-response bias in each survey. Bias cannot be measured directly. This is because we don't know how non-respondents would have answered a given question. So we're not able to measure bias in our survey outcomes. For example, we cannot know whether non-respondents might have different enrollment capacities than respondents. Instead, we conducted a survey non-response bias analysis in which we examined certain characteristics, also called covariates, that were available for both respondents and non-respondents to see whether the non-response adjusted weights lessened the risk for bias. Overall, results from the non-response bias analysis for the sustainability study showed the following. At the EHS program director level, there did not appear to be remaining indicators of meaningful survey non-response after weighting. Thus, based on available covariates we examined, the weighted results were sufficiently unbiased and could be considered representative of the EHS program director population from the 2015 round of grants. At the provider level, there may have been 2 remaining indicators of survey non-response bias after weighting, both for all providers and for providers in sustained partnerships only. The interpretation of results was largely the same for both groups. The covariates with the largest remaining differences after weighting in both sets of analyses described 1, staff turnover, and 2, whether the provider's grant recipient partnered with centers. You can find more information about the non-response bias analysis findings in Appendix A of the Data Users Guide. Based on the results of the non-response bias analysis, we recommend the following interpretation of weighted estimates. At the EHS program level, weighted estimates from the sustainability study represent the first cohort of programs receiving EHS-CC partnership grants. Similarly, provider-level statistics from the program director survey represents providers from the first round of EHS-CC partnership grants. It is appropriate to compare estimates from the program level of the sustainability study with those from the NDS to examine change over time, including in program director reported provider level change. At the provider level, we do not recommend assuming that weighted estimates of provider survey data are representative of all providers who partnered with the first cohort of programs receiving EHS-CC partnership grants. Weighted statistics at this level should be compared to statistics from the NDS with caution, particularly as evidence of trends from the EHS-CC partnerships more broadly, because weights do not fully appear to have mitigated the risk for non-response bias. When running analyses, we recommend controlling for any covariate provided on the file that could pose a bias risk. A bias risk can occur when a covariate is plausibly related to the estimates the data user is making, has an effect size greater than 0.05 in the survey non-response bias analysis, and there is a meaningful difference between the population estimate and the weighted respondent estimate. Data users should consult the survey non-response bias analyses results tables in Appendix A of the user's guide to assess what covariates are appropriate to control for their analyses, based on the 3 criteria listed here that could pose a bias risk. The study team has also included 3 covariates on the file from the PIR for this purpose, the Program Information Report, which are listed here. Additional covariates are not included because they could pose a data disclosure risk for the grantees, which means that not all covariates that are listed in the tables in Appendix A are included on the data files. For example, if you were trying to understand what supported or impeded partnership sustainability, our example research question, you might consider controlling for the proportion of birth to 3 enrollment capacity funded through the partnership and the method of developing the partnership agreement. Both of these covariates are plausibly related to the analysis, have an effect size larger than 0.05 in the non-response bias analysis, and show a meaningful difference between the population estimate and the weighted respondent estimate. In their user's guide, Appendix A shows the details of the non-response bias analysis. Each of the 3 survey data sets includes weight variables. Note that the program director analyses can only be considered representative if using the weights. While provider survey data cannot be considered representative with weights, it's still important to use them in the analysis. They help make the provider analyses more representative, if not fully representative. If data users are only using data from the sustainability study, they should use the relevant cross-sectional weight for the data they're using. These weights are not longitudinal, as they're meant to be used with the data collected only at one point in time in 2022. If data users merge the sustainability study with the NDS data, longitudinal weights are available for use. These weights can be used to analyze data showing trends or differences between the 2016 NDS data collection and the 2022 sustainability study data collection. So back to our example research question, we would want to use the weights listed here for the analyses of the program director survey and the analyses of the provider survey. While these analyses would represent all EHS programs in the 2015 round of the EHS-CC partnership grants, they would not be representative of providers who partnered with them. If we want to predict sustainability of partnerships using the NDS data, we would want to use the NDS level longitudinal weights for program level analyses and provider level analyses. There are three main limitations of the sustainability study survey data we want to highlight today. First, data users should not assume that provider level data is representative of all providers who partnered with the first cohort of programs receiving EHS-CC partnership grants. Second, data users should proceed with caution when comparing provider level data from the sustainability study to the NDS, particularly as evidence of trends. And third, data users should control for any covariate provided on the files that could pose a bias risk in the analyses. Now we'll talk about the data documentation. First, I'll explain each of the four primary data sets available for the sustainability study and then the documentation for them. The first column of this table shows the data set name as it appears on the CF data study page. The first data set is the EHS Program Director file, and it covers information from the EHS Program Director survey that was specifically about programs themselves and their partnerships. This data set has 161 respondents on the file. The next data set is the provider file reported by the EHS Program Director, and it covers information from the EHS Program Director survey that was asked about each sustained or dissolved childcare provider partner for the program listed in the NDS, not just those samples. If EHS programs have multiple childcare providers they partnered with, they would answer questions about each of these partners. Program directors answered additional specific questions on each sample provider. This data set has 1,105 total childcare provider partners included on the file. The third data set is the provider file reported by the provider, and it covers information from the childcare provider survey. This data set has 469 total childcare providers included on the file. Note that not all of these providers responded to the sustainability study survey. These 469 providers are the same ones that were sampled for the NDS childcare provider survey. And then lastly, the interview data is bundled to include 47 interview transcripts in a different file format and a code book to support the analyses. We have a few more details on this later. As previously noted, while we primarily are focusing on the sustainability study data in this presentation, more information about the NDS data, including the documentation and the data sets for the NDS, is available through CF data. Now we'll talk about the variable naming conventions in the files. The initial characters of each variable name are a prefix indicating the data source. For source items, the remaining characters indicate the item from within that source, generally based on the survey items in the source instrument. The characters after the prefix for constructed variables are mnemonic. Item numbering differs between the NDS and the sustainability study. Users conducting longitudinal analyses will need to consult both surveys to understand the item number in each study, as well as whether the survey item was modified for the sustainability study. The variable name should have a standard set of prefixes to indicate the source instruments for the data, specifically the program director survey or the provider survey. The EHS program director survey and all constructed variables reported at the provider level begin with P2D. EHS program director survey and constructed variables reported at the program level begin with D2. All data items from the sustainability study provider survey and constructed variables begin with P2. Variables from the PIR begin with PR, and key variables from the NDS that were used in the sustainability study non-response bias analysis begin with NDS. Please also note that all of the prefixes here include the number 2, such as D2 and P2. This indicates the data is from the sustainability study. In contrast, any data from the NDS uses a prefix that includes the number 1. such as P1 or D1. Now we'll shift to talking about missing values, missing data. Throughout the data sets, there's 3 potential reasons data can be missing. There's survey non-response, item non-response, and a skip. All variables in the data files use a standard scheme for identifying missing data and the reason why the data are missing. Different codes identify data that are missing for different reasons. First, there can be survey non-response, also called unit non-response, which occurs when a respondent does not complete the survey. This can mean they never started the survey, or they started it but only completed a small portion of it. Non-response weights are designed to specifically address this type of non-response, as the main analysis cannot directly include information from respondents who did not complete the survey, but it can try to adjust for them. Second, data can also be missing if a respondent was asked a question but chose not to answer it. This is item non-response. And the third type of missing value is a skip. This is the most common kind of skip is a logical skip. This is where the respondent was not asked a question because it did not apply, so the survey skipped it. The survey was designed so that non-applicable questions were automatically skipped over in the web-based version. For example, a child care provider and a sustained partnership would logically skip over questions designed only for providers whose partnerships had dissolved. When conducting our analyses, our approach was to omit the logical skip values from calculations since there are no applicable values. Additionally, we chose not to count logical skips as relevant towards our sample size or missing responses because the question was not actually asked to the respondent. An example of a logical skip would be the length of prior relationship with the grantee for a child care partner that had no prior relationship. The respondent would not have been asked this question, and there's no applicable value of the length of relationship that could have been included in the analysis. We have 3 different codes for item non-response. First, missing data are coded .m, and these are responses where a respondent chose not to answer the question, but they didn't say that it was because they didn't know the answer or they were refusing not to answer it. Responses are coded .d if respondents specifically said they didn't know how to answer the question, and .r if they said they would not answer a question. The .d and .r codes are only used for surveys completed via the phone, where we were able to gather more information about why there was not an answer. We also have 2 codes for skips. The logical skips are coded as .s, and the second type, which is similar to a logical skip, is .n, which is not applicable. Unlike a logical skip, where the skip logic was built into the survey, not applicable questions were asked of respondents, but still did not apply, so respondents did not answer them. These occurred rarely and happen in uncommon circumstances. For example, respondents to the sustainability study were asked about factors that supported or impeded the sustainability of their partnerships. Some respondents had not been in their position long enough to know the answer, so these instances were coded as not applicable. Please note also that the missing value codes used in constructed variables might be less precise than in the source items, as many constructed variables combined missing types. This slide shows how the survey questions appear in the code book using a survey question that could help answer our example research question on factors related to sustainability. The text inside the orange box shows the variable name. The P2 prefix means the question came from the Sustainability Study Provider Survey. F01E is the question number from the provider survey. All question numbers use 2 digits, so while the survey itself shows the question as F1, the variable is named F01. E indicates the specific factor that was asked about, which is shared decision making. The text inside the yellow box shows the variable label, which describes the variable. The text inside the light blue box shows the survey question text. This may not be exactly the survey wording. It's usually trimmed down to fit into a shorter description. The text inside the red box shows the possible values that a variable can take, along with the labels for each value. The value of 1, for example, means the respondent said shared decision making was not a support. The text inside the dark blue box shows possible missing value for the variable, with .I showing the respondent did not respond to the instrument or to the survey at all. .N shows that the question was not applicable to the provider. Finally, the text in the green box shows the simple unweighted summary statistics for each value. You can see here that 7.25% of respondents, or 34 respondents, said that shared decision-making was not a support for sustainability. This slide shows how constructed variables appear in the codebook, using another variable that could help us answer our research question on factors related to sustainability. The text in the orange box shows the name of the constructed variable. The P2 is the same as the survey question. However, instead of seeing a question number after the underscore, here you'll see the word sustained. When the variable name does not include a question number, it means it's a constructed variable. The yellow box also shows the constructed variable label, indicating that this variable shows the sustainability status of partnerships. In our example research question, we could use this variable to conduct subgroup analyses based on whether partnerships were sustained at the time of the 2022 sustainability study. Many constructed variables will be fairly obvious from the label, but when it's not, there's an additional document that includes narrative data documentation. And finally, the green box shows the same summary statistics as on the prior slide. You can find more information about how we made our constructed variables in Appendix F of the user's guide. Before making the files available to the public for restricted use access, the study team reviewed transcripts and removed any personally identifiable information deemed non-essential for analysis. We developed a guidance document to help study team members redact content. Guidance included recommendations for stripping unique identifiers and geographic details, removing information associated only with study administration, and removing rare events and publicized information. Each transcript was reviewed twice, once by the task lead and once by a senior team member. As with the program director and provider surveys, we replaced participants' names with randomized IDs to protect their privacy. We cannot use the ID in the interview data to link to the survey data for the same reason. To support analysis, each file indicates the basic characteristics of the interview provider. The files also note if there is anything unusual about the interview. For example, in a few instances, we interviewed providers that we thought were in sustained partnerships, but it turned out their partnership had dissolved. We also interviewed providers that did not complete the survey, and the transcript files document that at the beginning. The interview data also has missing values that are noted in the transcripts with the text saying question not asked. Question not asked already answered means that some interview questions were intentionally skipped if the interviewer determined the question had already been answered in a previous response. Question not asked, not applicable means that some interview questions were skipped if the question did not apply to the respondent. Question not asked, time constraints means that the question was not asked because we ran out of time. The zipped qualitative data package contains 47 interview transcripts. Each transcript is available as a PDF, RTF, and TXT file, and there are 141 total files. File names have dissolved or sustained to identify partnerships. This slide shows the format of the interview codebook, which is an Appendix K of the user's guide. This can be used to help analyze the data using qualitative software. The codebook is organized by research question and then sub-research question for the study. The yellow box shows the research question. The orange box shows the sub-research questions. Each sub-question also includes some constructs and sub-constructs that can be used for analyses. In the qualitative data software, these become codes. For each construct and sub-construct, we identified whether they applied to sustained partnerships, dissolved partnerships, or both, as shown in the light blue box. We'll now talk about merging the sustainability study data files. This slide offers a summary of the key identifiers in each of the sustainability study data sets that are helpful for merging. The program director survey has a unique program ID number. The program director reported provider level file has unique ID numbers for programs and providers. And the provider survey also has a unique ID number for programs and providers. These unique ID numbers mean that programs and providers can be linked when merging data sets, so you can determine which providers partnered with each program. It's important to note that only the survey data can be merged together, and data users cannot link the qualitative interview data to the survey data. Now let's walk through an example of how data from our research question might be merged so we could compare alignment and answers from partnered providers and program directors. Item E4 in the program director survey and S1 in the provider survey asks the same question as shown here. We could merge one-to-many between the two data sets using the program ID unique program identifier so that we're matching programs to provider partners. This would allow us to compare answers to similar questions from both partners. We'll now talk about merging the sustainability study survey data with the NDS survey data. As we just described, you can merge the sustainability study data files together, and users can also merge files from the sustainability study to the NDS. In each data set, the variables labeled NDS program NPR-ID or NDS provider NPR-ID provide the linking ID to the NDS at both levels. These unique ID numbers mean that programs and providers can be linked when merging data sets, so you can determine which providers partnered with each program. Lastly, we'll talk about some resources available for data users. The Sustainability Study User's Guide is a key resource for information about the study design, data collection procedures, response rates, data review and editing and preparation for the file, data file structure and use, and details on the constructs created from the data. The User's Guide also includes appendices that provide detail on the data, including survey and interview instruments with variable names, and survey non-response bias analysis tables. The survey codebooks for each of the data files and the interview codebook are stored as separate documents from the User's Guide. These survey codebooks include descriptions of each of the variables included on the file. The interview codebook includes the constructs and subconstructs used to answer the study's research questions. Users can also reference the sustainability study data tables, which provide key information about the designs, methods, and findings from the study. Note that the User's Guide and the codebooks can be found in the Data and Documentation tab on the EHS-CC Partnerships section of the CF Data website, which we'll preview later in the presentation. You can also find data tables and other, including reports and briefs from the NDS and the sustainability study on OPRE's website. If you have any questions about the data, we're always happy to help. You can send questions to CF Data and they will forward them along to us.
Okay, now I'm just going to give a brief overview of the archive and how to find the data. So as I mentioned earlier, CF Data preserves and disseminates data on topics related to early care education and families and communities, as well as the programs that serve them. We have almost 400 data sets along with accompanying documentation, and all of the data are available for analysis at no additional charge. We have a wide range of different kinds of data sets, as you can see here. So from federal and state funded programs, administrative data, community-based surveys, and observational studies in classrooms and homes. Our website can be found at childandfamilydataarchive.org. I just want to highlight the first tab on the website called Getting Started is a great quick intro to some of the main resources on our website, including the infographics that give us summary of the breadth of data, as well as a short video with tips on finding data and searching for data and some of the most frequently asked questions. There are also some data-related tabs. So under data, you can find any of the data sets that search by subject terms if you're not sure which data set you're looking for. And you can also search the variables across all the data sets, as well as look at publications that have cited data that is housed at CF Data. On our About Us page, you can find more information about our project team, CF Data, and announcements about future data releases and upcoming trainings as well. We have a video resources page where you'll find past recordings of past trainings that we've done. So the recording of today's webinar will actually be found on this page as well, along with the slides. So that was just a brief overview. You can learn more about us on the About Us page and watch this fun short video that gives more of an overview about the collection and the resources available. So now for accessing the EHS-CC Partnerships data, you can search for the study under the on the main CF Data website. And that will take you to the search results page where you'll see that the EHS-CC Partnership Study is the first one listed, which will take you to the study homepage. So the study homepage is where you will find important information such as a summary about the study and information on the study's methodology, sampling, weights, and more. It's also where you can search and compare variables and view publications based on previous use of the EHS-CC Partnerships data. This data set is restricted, so a restricted data application is required. However, users can download publicly available documentation as a preview. So this is, again, the variables tab that I encourage you to take a look at to learn more about the data set. And then once you've decided that you'd like to access this data, you can begin your application by clicking on the Access Restricted Data button and completing the sections that are shown next. So the application requires several pieces of information, including a description of the intended research project, a data security plan, an IRB letter, and a signed restricted data use agreement. Archive staff are available to assist you with your application and to answer any questions that you may have along the way. You can just email us at cfdata-help@umich.edu. And then lastly, if you have previously already had access to the NDS data, you can actually go into your application and click on the data selection section. And then once you click on the link that shows the study number, it'll list all the data sets that within the study that you have access to. So the blue ones are the ones that you already have access to. And then if you'd like to request the sustainability study data, you would just go through and check the data sets that you need. And then click Save and Continue, submit that application, and our team will review and approve that modification to your application. So now I just want to turn it back to the Mathematica team to close us out before we answer a couple questions.
Great, thank you. We wanted to quickly acknowledge the funders who made this project possible. The Office of Planning, Research, and Evaluation with the Administration for Children and Families at the Department of Health and Human Services. We'd also like to acknowledge the rest of our Mathematica project team. And finally, we'd like to acknowledge the early Head Start programs and childcare providers who were so generous in sharing the information that made this study possible. For more information, please feel free to reach out to myself or to Sheila. We've also listed email addresses for our OPRE project officers, Jackie Gross and Janessa Malin.
Okay, and now we are happy to take a couple questions. If we don't have time to answer your question, please feel free to email us at CF Data and we will be sure to get your answer back to you. The first question that I see is, if EHS programs had multiple CCPS, did they answer survey questions on each partner or on their partners in total?
This is a great question. So we asked for each partner whether or not the partnership had been sustained or dissolved. If the partnership was dissolved, we asked several follow-up questions, like when it was dissolved, whether the COVID-19 pandemic was a factor. We also asked programs to confirm or update contact information for all of the sampled providers so that we had that information to reach out to them for the provider survey. We then asked a few additional questions, asking program directors to think across all of their partnerships in total. So things like overall factors for sustaining or impeding partnership sustainability were asked across all partners. So it was a little bit of both.
Great. Next we have, can I compare data from the sustainability study to data from the NDS?
At the EHS program level, yes, you can compare the estimates from the sustainability study to the NDS. And this includes two files, the program director survey data at the program level and the program director survey data at the provider level, where program directors reported on the providers they partnered with. You can use comparisons for 2022 to 2016 as evidence of trends over time. And to the extent possible, we tried to keep the questions the same between 2016 and 2022 to facilitate these comparisons. At the provider level, though, you should use caution when comparing statistics from the sustainability study to the NDS, since the weighted estimates from the sustainability study cannot be assumed to be representative of providers who partnered with programs in the 2015 round of grants. So data users who wish to examine change over time or trends from 2016 to 2022 should be cautious in how they're interpreting those estimates.
Okay. One last question. Can I merge the qualitative interview data on the survey data?
You won't be able to merge the two together. The qualitative interview data is not linked to the survey data at any level.
Okay, great. Thank you. So I just want to do a quick reminder to everyone to visit the CF Data website to request access to these data. You can also sign up for our listserv to receive notifications on data release announcements, data webinars and workshops, as well as our quarterly newsletter. And lastly, please contact us at cfdata-help@umich.edu if you have any questions or require any assistance. So I just want to thank all of you for joining us today. And I also want to thank you, Liza and Sheila, for sharing all of this great information. Thanks, everyone.
Thank you.